Weston. I'm Senior Lecturer in Health Technology at the University of the West of England, and I do research on various uses of AI and data science for health applications. But hypothetically, we could think of me as someone working for a private profit-making company who wants to develop AI for health applications that will make them money and also benefit the rest of us as well. And those kind of people are an important part of our innovation landscape, so we shouldn't shy away from thinking about them at the same time.
Our workshop was on trusted research environments for health data. Essentially, we're talking about how we can make our sensitive health data available for use in research without compromising all of the concerns that we would have about confidentiality of that data. So getting the best out of the data while protecting our data. Society in general, especially over the last few months, has become very much increasingly aware of the broad power of AI and data science, that it could potentially be something extremely useful for us. And people are also increasingly aware that there are risks involved. I come from an AI research background. I'm the developer who wants to access the data. Professor Felix Ritchie is Professor in Applied Economics and has a long history of working with the Office for National Statistics and helped very much to develop the principles of data governance, these ideas like the 5 safes that a lot of these operations are founded on. Andy Gibson, who's an Associate Professor in Patient and Public Involvement, so his job is all about these conversations with people and how we engage the public and patients and make sure that they are involved in any work around their data and any research about them, whether it's in health or urban planning or anything else. So we brought together those 3 people, the person who really understands the governance frameworks, the person who knows how we should be engaging the public, and me as someone who just wants to be able to use all of this to get access to the data and build great things with it.
I want your data, but you might not trust me, so maybe you don't want to give me your data right now. That's fair enough. I could go and ask someone else for your data. I could go and approach an NHS trust that you've been treated in, and legally they could give me your data under certain circumstances. So if you haven't used the national opt-out policy, hopefully you know that there is one, and if that data has been anonymized or de-identified, and if they have confidence that I'm going to use it for patient benefit. I could approach the trust, or I could go through NHS Digital's data access request service and ask to access some of your health data. And even if it's for profit, I might get it. If I'm lucky, then a dataset might have already been created and curated and set up for research where someone else has done the tricky work of making sure it's thoroughly anonymized, and I can apply for access to that data. But if I can only work with thoroughly anonymized data, then that really limits what I can do, especially if I'm conducting analyses or developing advanced AI that relies on rich, multifaceted data. And I've been in this situation where, with a narrow data set, I've reached the point where I know I've reached the ceiling of performance that I can hit with that data set, and that to get better, I would need to bring in this other variable or that one. But that's a challenge for an anonymized data set, because even if all the direct identifiers, things like your name and your date of birth, have been removed from the data set, you might be the only 23-year-old black woman with multiple sclerosis and epilepsy in the area, and then, in theory, I might recognize you from your de-identified data, and I might discover confidential things about you. Now, you might think that if I'm a well-meaning researcher, then that's an acceptably small risk. But if I'm a well-meaning researcher who's also fallible and doesn't have appropriate safeguards around me, then maybe I will accidentally leak that data set, and then a more malicious actor could find it and exploit it. So just directly identifying a data set isn't really enough to give us that confidence that we need. What we really want is for our data custodians to have confidence that they can prevent that scenario, that the clumsy researcher doesn't ruin everything. And trusted research environments are an important part of that solution. So what is a trusted research environment? You might hear the terms safe data havens or secure data environments, which essentially mean the same thing. We're talking about a platform that allows a researcher to analyze data without receiving a copy of it. So it's a bit like Homer Simpson's nuclear glove box, that there is a way for the researcher to interact with the data, but it still provides a protective barrier between the data and the researcher. But we can still get what we want out of it. So I guess in the nuclear glove box, we want to leave the radioactive stuff in there and just get the energy out. And in my case, I want to leave the data in there and just get the insights out, the ones that don't disclose anyone's confidential information. And a trusted research environment is a platform that allows us to do that, where essentially I, as the researcher, could be working on a computing resource that has access to that data, but it is blocked off from the outside world, so I can't remove that data from the system, and any insights or results that I do want to pull out of the system would need to go through this sort of airlock where someone can approve that I'm not disclosing confidential information by taking those results out of the environment. That's a very simplified vision of what a trusted research environment looks like. In practice, one might look more like this. There are a lot of open source architectures available, so we know good ways of building these things. This is one called the Treehouse, developed by the Health Informatics Center at the University of Dundee, and it's an expanded version of my previous slide. The research is still down there. There I am in the lower right corner. There's a range of technical safeguards built around it, and as well as various other people involved, auditors and data managers. So this is not a casual operation. We have sophisticated ways of doing this and allowing data to be accessed while preventing it from being leaked. And there are several of these operational in the UK now, so we've got just a few examples listed on here. It's very possible that your data has already been used in one, and it's very likely that they're going to become more common. So a key recommendation from the Goldacre review, this was the report released in 2022, so just last summer, commissioned by the UK Secretary of State for Health and Care. A key recommendation there was the widespread use of trusted research environments, or TREs, for health data research and analysis. And I would say that that's a good thing. We should use these things more. I want to use them. But that should only happen if the public are broadly aware of that, this is a way that their data is being used, and they've had a chance to discuss all that. So I said that we were here because I want your data, and I still do, but more specifically, I want safe, transparent access to your data so I can use it for patient benefit. I want to achieve that transparency, we need to make sure that this whole concept has been subjected to plenty of public discussion. So that's part of what I want to achieve here today. So we'll have a lot of time for broader discussion with you all after we hear from Andy Gibson, who's Associate Professor in Patient and Public Involvement and who's involved in a lot of the most important regional and national projects in this field. But before we hear from him, we will have a crash course in data governance principles, and I think there's probably no one better qualified in the world to do that for you than Professor Felix Ritchie. So I'll hand over to Felix.
Okay, so I'm going to talk about data governance. David has talked about a practical solution. I'm going to give you a bit of an idea about the wider context and how we think about these things, because the UK is quite a leading thinker in those areas. And it's relatively straightforward, but if you're not considered, this might be something that give you a different perspective on things. So this is a question which I want to ask. Can we use and share confidential and sensitive data for research safely and effectively? Okay, the answer is yes. Any questions? Okay, I'll give you a bit more detail on this. I mean, let's suppose you're thinking about data sharing. You might think about, the IT as one of the issues that surely, as David has said, we can build these really complicated systems, but the IT is going to depend upon the level of detail that we have in the data. Really sensitive data, maybe we'll have more IT protection. With less sensitive data, maybe we'll have, we'll allow people to move the data around, but that's also going to depend upon the law or the ethics behind this. But that's also going to be affected by the users that we have, because surely we need to think about how people are actually going to use it. That's going to matter. And what about the contracts? Is that going to enforce how they use it? But those contracts will depend upon the anonymization, which again depends upon whether it's okay for the users. And then again, are they going to use the IT in the way that we've expected? And what about the law that governs that access to that data? And so on and so on and so on. So lots and lots of different things we need to be thinking about here. And this is where we started thinking about something we call the 5 Safes framework. That was designed specifically as a way of generally thinking about how do we manage things, in a sense, in a way to say, we'll give everyone their turn to make their opinions about these things, and then we'll bring them all together in a coherent framework such that we can look at different options in a coherent, consistent way. So this is what we mean by the 5 Safes framework. We're going to go through, and we often frame it in a sense of 5 questions. So first of all, is this an appropriate use of the data? Is this ethical? I'm not going to carry lawful. Lawful is part of ethics, but ethics is the big question we need to be thinking about. Do we know why we're doing this? What's the public benefit for this? What's going to happen to the data at the end of the project? Do we know what's going to be the next consequences? So that's our first thing. We're going to think about what we might call safe projects. Then the second thing is, how trustworthy are the users? Now, by that, I don't mean, do I think David is someone who's going to walk off with the data? What I'm thinking about, do I trust David to be human? Now, humans are generally nice, well-intentioned, supportive, particularly researchers. They're lovely, lovely people. But they're also humans, which means that occasionally we're ornery and difficult and lazy and sometimes incredibly stupid. As a researcher, I feel free to say this about myself. So if I'm designing something for people, what are the people I've got using this system? Do I need to train them? How do I need to work with them? Does the environment itself prevent misuse? So David's talked you through the trusted research environment. That's designed to be very, very secure. Okay, if we're not using that, what other controls are we putting in place? Are we allowing people to store things on open servers? Do they have to be on closed servers? Are we going to allow people to put stuff onto portable media? Then is the data detail appropriate? No, it's just not, is it minimized, but is it appropriate? Because remember, the whole point of doing this is that we can use data for research. Okay, we don't use data minimization or risk minimization or any of these things. That's where we want to be. That's my goal of using that data for research, and we've gone through the projects to realize that that's a goal that's worth having. So what I'm interested in is what's the appropriate level of data to allow me to achieve that target. And lastly, one which is always forgotten about, is what about the outputs? What happens if I do everything else, I've got my lovely secure data and it's all for a great purpose, and then I happen to, one of my outputs, release the information that actually there is only one 29-year-old bishop in St. Austell with a wooden leg. I might release something like that. So how do I prevent that happening? The idea is to put all of these together. That gives us safe use. Now, the word safe is a bit of a misnomer on here. What we really mean is dimensions of control, because you don't have to have everything here safe. The whole point is you look at different elements and put them together, and then you work out, okay, what are we going to control in particular environments? So let's consider, first case, we might have data available on the internet. Okay, so I'm going to take my examples all from the Office for National Statistics, ONS, because it produces all the things I'm going to talk about. So it produces some data that's available on the internet. Now, on the internet, we obviously can't control who's going to use the data, what they're going to use it for, where they're going to hold it, what they're going to produce from it. The only thing we can do is protect the data. Okay? So, still within the same framework, but what we've identified for this particular use, all our effort goes into anonymizing that data within an inch of its life so that we're confident there is no chance of re-identifying anyone from that. So that, for example, could be something like the Labour Force Survey teaching data set. It's survey data, it's personal data, but it's made available and it's designed for teaching, so there is no confidentiality risk in there at all. Okay. Second example might be data circulated under license. So someone like me writes to the Office for National Statistics and it says, okay, I'd like to get access to this data. And they'll say, okay, are you an academic? Are you a researcher? Give us some details of what you want to use it for, and sign up this agreement saying that you're not going to put it on a portable media, you're not going to store it on personal devices, you are only going to store this information on your university servers. And if you do that, then we'll give you the data to work with. So they're giving the data to me. So we've got some controls on what I'm using it for, because I haven't made a commitment, and they know who I am, so they know I'm a valid researcher, and they've asked me to make sure I look after the data, and they will also make me look after the outputs as well, although being a researcher, I'm obviously not going to read any of those instructions. But because we suspect that some of those things are going to go wrong, we still put quite a lot of information, effort into reducing the detail of the data. So if I want to get a downloaded version of the labour force survey, it's more detailed than the one that's available just on the internet without restriction, but it also still has quite a lot of information removed from it. So if worst came to the worst, I decided that for reasons of my own, I would copy it down onto a memory stick, and then I left it on the bus, and someone else picked it up. There is a higher chance that someone could identify someone, but not necessarily. You'd have to be quite good at doing this. So then we get to the third case, which is the trusted research environments. And these are the ones which David talked about. So again, I use the ONS Trusted Research Environment. I also have access to a version of the Labour Force Survey in there. And in there, that is essentially the survey as it comes hot off the press. All that's done to it is names, and most of the address has been removed from there. But apart from that, it's the raw data. So we can have no controls effectively on the data because we have extensive controls over everything else. So I have to go through a long approval process, which at the moment takes about 3 to 6 months. We're trying to improve that. I have to be a certified researcher, so I have to go through a training program and prove that I have the appropriate training. The environment itself is reviewed and certified every year by the Statistics Authority as being a secure place. And finally, in ONS, all the outputs go through a team which have been trained to actually check those outputs and make sure there's no risk. So because we've got all of those together, then we say, great, this is the place where people like David can work on the most sensitive types of data. So that's the broad framework, and you see where you can use it in all sorts of different ways. Why does it matter? It matters because it's quite widely used now. In the earlier talk, we had discussion about the UN AI framework and how they've sort of agreed that. It's the UNESCO AI framework that's been agreed, but not necessarily being implemented at the moment. This is the other way around. This is something which we came up with in the UK. It works for us. More and more people are now using it. So, for example, Australia, Canada, New Zealand, like the UK, have built all of their social science and health data research around this. And the funding councils use this, and NHS Digital uses it. And it's quite nice and it's flexible because it's not very detailed, so it can work with all sorts of things like, for example, ISO 27001, which is an IT standard. So the advantage of this gives us a sort of consistency across different ways of looking at these things. It's very easy to look at something like, say, Open Safely, which Andy is going to talk about, is one particular type of trusted research environment. And the ONS one, which I use, which is a quite different type. But we can compare the two and look and see what the differences are. Or similarly, during the pandemic, ONS started, previously you had to have access to their facility, you had to go to your university site or a safe room. But during the pandemic, they started having access from home. Now, home access, in theory, could be seen as a less secure environment because you don't know who's behind you. Maybe the kids are leaning over your shoulder and they're really desperately keen to learn how to program in Stata. So it might be a less secure environment. So what they did was they changed the contractual agreements to tie you in more closely with your organization. So a bit less on the setting, a bit more checks on the people. Okay? So it gives us nice and comprehensive. There are discussions about having more safes and different ones, but broadly, the idea is to be simple enough to sort of cover everything and help you have your checklist going through. It gives us this common language. So as I say, although lots of organizations don't use this as a design template, increasingly, this is a language that people use when we go to conferences and we talk about these things. It just pops up and we all know what we're talking about. And it blends itself quite nicely to certification, because you can think in each one of these areas, we can sign things off. So, for example, in case of the UK and the TREs that David mentioned earlier, so for each of those, all of the ones we've got have some sort of ethical approval processes that are going through. So there's one specifically for government data. There's the NHS approval process. And there are other processes by the approved governments. There is one nationally accredited training scheme for all the social science researchers. There is also a scheme at the moment run by the MRC. Again, so we can tick people off and say, okay, you are an accredited person. Tick, we meet that target. There's accreditation systems for these things. Either the Stats Authority or the NHS will come around and check your system to make sure it works. So again, we can tick that off. Safe person using a safe system. We've reviewed their projects. In terms of the data, we don't have standards for that, but the thing is, we've known how to anonymize data for 50 years. So when we're designing these things, we usually say, don't think about the data, because the aim is to do research. When you've decided everything else, we can anonymize the data as much as we like, because we know how to do that. So when we know everything else, then we'll decide what's the appropriate level of data. And lastly, there's a national accredited training for all the people running the lab to make sure they can check the outputs. So it's all nicely fits together. Problem with this, it is a framework. It's not an instruction manual. I've given you 5 areas to look at. You could ignore them quite happily. A number of places say, including HDR UK, which funds lots of health research, you need to be 5 safes compliant. It means nothing. We don't know what 5 safes compliant means. Here's a project which is 5 safes compliant. Okay, I think this is a good idea. I'm only going to share the data with my mates. I'm going to keep the data at home because the kids aren't interested. I've looked into the data. I don't recognize anyone, so why should anyone else be able to do that? And we're only going to produce statistics anyway. Okay, so I've just considered all 5 safes on there. I'm 5 safes compliant. Would you trust me with your data? Of course not, no. So that leads us on to, we know an awful lot about how to do everything ethically, technically, and very, very efficiently. Doesn't mean we didn't do it well.
One of the things, though, is that I'm talking from a very idealistic perspective. You know, the problem is you set up these environments and they could be brilliant. They can also be terrible and yet still compliant with some of the ideas. So hence, that's why the point of bringing Andy in was to take it back and say, okay, well, we know how to do these things, but should we do them? Why do we do them? What are the constraints on there? And that's what we wanted to be able to put this together. This is a great thing. This is how it fits into things and how things are developed over time. But this is what we still need to worry about, is the why we're doing this.
Yeah, so we've been through all that. Doesn't still answer the question, who's actually making the decisions? Who's deciding if that 5 safes applied well or not well? We've got all these trusted research environments with their safety measures, and we've got the 5 safes and so on. But actually, it all hinges on putting it into practice and who has the power to make that decision. And this is a particular thing people remember care.data a couple of years ago. This is where this comes from. That wasn't a conversation with the public that went particularly well, as people will remember. But that is a conversation that I think we've got to have with the public about what's happening with these trusted research data environments. And I've put on there, there's a slightly sensationalist bit that I've put, image that I've put there. Having said that, I think there are certain people in government who'd be very happy to do that sort of thing if they thought they could get away with it. So I think it's about how do we build in the safeguards and the accountability and the transparency to the wider public about how this stuff's working, and that's what we've got to address.
There's a trusted research environment called Open Safely. It looks at 58 million people's health records. It's primary care data. That data was used initially to figure out who should self-isolate, who's at most at risk. A bit later in the pandemic, it was used to decide which order we should do the vaccination. So tremendously powerful, but at the same time, people aren't aware of it. And although that was set up as a temporary thing, because it's been so powerful, lots of people, including government, want to make it permanent and also expand its role from away from just COVID-related research to other areas. But that raises big questions about that data and whose permission and what kind of accountability and what kind of transparency. So I've been doing that work with Open Safely, and then when I heard about this seemed like a really good opportunity to begin, albeit in a small scale, some of that wider public conversation about these trusted research environments, there's going to be more of them. They're going to transform the way we do all sorts of healthcare and health research. The public just need to be part of that conversation. There was a lot of questions about who's the right people to talk to the general public and particularly talk to underserved communities. Are health professionals or academics the right people to do that? I don't think that's the case. I think what we need to do is get people from particular communities, particularly underserved communities, who experience the biggest burden of health inequalities, but are also the people who are most likely to distrust these things and probably the most likely to actually opt out from having their data part of these things. So that conversation is really important because potentially those people can get the biggest benefit. And it was really interesting to have those conversations with other people. How do we do that in practice? Who's the right people to do it? Can we really have that level of accountability? And so on. It was really interesting to have that discussion with a wider audience.
If we want AI and data science to work for us, then it needs to be developed with our data. So we need to have a serious conversation about how we want that to happen. We know how to do this, and it is being done already, but to do it on a larger scale, we just need to make sure that everyone knows about it and that everyone's been included in the conversation.
What gives me hope is there are lots and lots of good examples out there. Not everyone does everything as maybe I would like, but there's a lot of good practice out there, and what we're keen to do is make sure that we shine a light on the good, so that those who are perhaps not quite so effective can learn from that and develop.
I'd like to be able to walk up to anyone on the street and talk about how their data has been used in research recently, and for them to know, oh yes, my data was in that research environment. So for it to be everyday language. And I think a key way for that to happen is going to be for politicians to start talking about it, and if it comes into their everyday language, then they can make it a part of the public's everyday language. We're interested in all of it. All of this data does have value to us. There's great insights we can get from the kind of informal health data that comes off your smartwatch, and also from the kind of data that is held by your GP or an NHS trust that goes into your official health record. And we're interested in the things we can do by linking those together and combining insights. So seeing, okay, you received this change in your medication, and we've seen this change in your heart rate over the last few weeks as a result of that. So. Yeah, all the data is of interest to people like me, just looking for the frameworks to combine it all.
It was really nice when we finished. A load of people came up to us after us as a group and started asking questions. People who didn't get their questions in on in the time that was allocated. It was really great to talk to some people who've come from kind of a comms and communications background, people who are researchers wondering how this would work, people who've come from a very techie background, people working from a community background say, so how do you get somebody from an underserved community to get really interested in a trusted research environment? I always think that one of the things about these events is you've got your own ideas and you meet other people's ideas and you take the best away and amalgamate it into your work, and you can only do that through the kind of conversations you get at an event like this.